Compliance. Thank you, everyone, for joining us. And I'm the Client Services Specialist. I joined Commercial Investigations in December of 2013. I have a master's degree from Jay College of Criminal Justice in Forensic Psychology. I worked for 6 years as an investigator with the federal government conducting background investigations, and a total of 12 years working with government agencies in various roles. You can contact me anytime at 800-284-0906, extension 214, and you can always email me at CourtneyKayla@commercialinvestigationsllc.com. Also on the webinar today is Lynn Migliori. She is the head of our business development team. Lynn joined Commercial Investigations in October of 2013. She has experience with sales and of 15 years experience with administration and customer service. You can at 800-284-0906, extension 216, or mail her at lynnmigliori@commercialinvestigationsllc.com. And also joining us today is Michelle Punch. She is the president of Commercial Investigations. Commercial Investigations in March of 2004. She's a licensed private investigator and ran her first background investigation in 1991. You can contact Michelle again at 800-284-0906, extension 202, or email her at michellehayan@commercialinvestigationsllc.com. And about us. Commercial Investigations is a certified women-owned enterprise and a New York State licensed private investigative agency. It is to be the most innovative and educational background investigations partner. Our webinar is on Healthcare Comply Plus. The definition of that is Healthcare Comply Plus is a powerful suite of comprehensive medical screening solutions designed to reduce risk in the healthcare setting by assisting in the verification of practitioner credentials and the identification of sanctioned individuals. It's an abuse information system that can historic records of disciplinary actions, debarments, sanctions, exclusions, and all provider types at state and federal levels. Healthcare Comply Plus will reduce the risk to your organization by adding multiple state and federal sources to assist in the identification of healthcare providers who histories of federal or state level disciplinary actions or disqualifications, or may otherwise place your organization at increased risk. Turn it over to Lynn, and she'll talk about who uses Healthcare Comply Plus and what it covers.
Good morning. Thanks for joining us today. Let's talk a little bit about who uses Healthcare Comply Plus. Sites include hospitals, nursing homes, assisted living facilities, practices, health placements, and many more. Let's go over some of the coverage for Healthcare Comply Plus. This requirement is for the Office of Inspector General Complaint Program with information for the government sources. Health Services, OIG, also known as SAM, which is General Services Administration, Administration, Drug Administration, and Care Channel. These are state and federal sources that assist in the identification of healthcare providers who may have histories of state and federal level disciplinations or disqualifications, or may otherwise place your organization at increased risk. In their compliance efforts with the U.S. Patriots Act, and a multitude of databases covering U.S. and foreign sanctions and watch lists by providing U.S. and foreign governments and organizations. Now through some more specific lists of government agencies and other organizations searched. Office of the Inspector General sanctions for open management. There are 20 plus states that are state Office of Medicaid Inspector General exclusions, state licensing and area actions, 10 most wanted, Drug Administration, the National Fugitive Watch List, and the Department of Treasury, Office of Thrift Provision, of the government agencies and organizations search, the Office of Conservative Currency, the Department of Health and Human Services, Office of Inspector General, Department of Justice Drug Enforcement Administration, Bureau of Alcohol, Tobacco, Firearms, and Explosives, Department of Affairs and Trade, U.S. Department of Commerce, U.S. Department of State, of the Superintendent of Financial Institute. Just to go over a few more of the government agencies and organizations, such as the Bank of England, U.S. Secret Services, United Nations Security Council, World Bank, Deposit Insurance Corporation, U.S. Treasury, Office of Assets Control, and Study Designated National. Partial list of the government agencies and organizations first. To go ahead and turn it over to Michelle now, who will talk to you about the results of healthcare compliance.
Thanks, everybody. We provide the results for Healthcare Compliance Plus in an easy-to-read report that includes information from several state and federal agencies that we've been talking about. It indicates if disciplinary action was taken. Our information generally contains the action, description, state, authority, and date if available. So exactly do the results look like? For you've used Healthcare Compliance Plus, you've seen our results in the past. We're going to go through a few examples. I want to with the no results found. So you can see what probably maybe 90+% of your Healthcare Compliance Plus will contain no information found, which is what you want, because what information is found is disciplinary sanction and exclusion information. So we have two parts to the search. We've got the medical information and then law enforcement information. And those that Lynn was mentioning to you. So we hear the results for this individual's medical information found and law enforcement information found. Then we talk a little bit about the coverage to contain some of the information right in our report so you know what was searched. And we talk again about state and federal sources that assist in the identification of providers that have a history of put actions or disqualifications which may place your organization at an increased risk. To assist you in your compliance efforts with the USP Act, and includes a multitude of databases covering U.S. and foreign sanctions, watch lists, and other types of international action lists. List some of the most popular ones. Your reports will have this information right in them. What happens when we have a result? We have an individual that under medical information actually has two results. We first saw names coming from the Colorado Department of Regulatory Agencies, and this person received a letter of admonition and indicated that the individual had an adverse action against them. We see the source listing the Board of Med Examiners. So these lists we're searching, sometimes the same information comes up in multiple lists. So that's essentially what we're seeing here. We're seeing two different sources, and we're seeing essentially the same information. And in this case, this is interesting. I find these almost sometimes a little more interesting than some of the criminal records we found. And get quite a bit of information, where with criminal records you won't get as much detail. So an individual will decided not to commit with formal proceedings against the licensee and practitioner at this time. But it is a physician assistant who treated a 40-year-old patient were to him from a primary care physician. And eventually, the individual was to obtain narcotic prescriptions only from the physician's assistant during office visits. And is the physician fill multiple lost prescriptions and not verify whether the patient was obtaining narcotics from other providers. The physician's assistant also refilled prescriptions at our home and other locations without the required office visit. August of 2009, the physician assistant discharged the patient from the practice after he was charged with obtaining prescription drug false information. The board basically found that the care that the individual physician assistant was giving the patient fell below the generally accepted standards of medical practice for the physician's assistant. So at this point in time, they decided to give him the LOA, the letter of admonition. But in that, they indicated the complaints, further complaints, disclosing any repetition of such practice may lead to the commencement of formal disciplinary proceedings. At that point in time, this particular letter of admonition entered into evidence as aggravation. So we have an individual who didn't necessarily lose their license. He's licensed to practice, but you have an action taken against him with the admonition. This is an interesting situation from that particular standpoint. I wanted to go over contains change. Now this one up because a lot of times we talk to our clients and our prospects about a policy including a 10-year all jurisdiction. So you have a search like healthcare compliance, which is a name-based search. You're not doing all the names the individual used in the last time. Generally 10 years is now the acceptable limit that people are doing. You missed something. So we have Jennifer with the last name of blank, and she has no medical information, no law enforcement. If you would know that Jennifer, under her other last name, we had a disciplinary action against her. And we have results of 2, and it's a bit duplicative because it's 2 different sources. But this one is really interesting. The individual, Jennifer, voluntarily agreed for a period of 3 years to have her research supervised, and any institution employing her would submit with applications for government funds, certain manuscripts, and other documentation indicating that she's working on the research, which they're getting a grant. Second, in this case, is we have obviously a research assistant. And the first summary comes from the Office of Research Integrity. Now, the Research Integrity found that this former graduate student in the Department of Cell and Developmental Biology has conducted the research and was there a number of grants at that point in time. So falsifying data included just had this action taken against her. It's extremely interesting because you wonder about all the research that goes on out there. In this particular case, she's researching on Western blot. For those of you familiar with Lyme disease, Western blot is a detailed test for Lyme disease. And there's not a lot known about Lyme disease, and it's kind of interesting how she falsified results to meet what the of the grant was trying to obtain, but the results of the research weren't really showing that. She went on a number of information, including figures and graphics, that published in a number of journals involving medical research. So it's pretty interesting as we read through this and go on about what she went through and the different falsifications that she was involved with. As further through her healthcare compliance results, we see the second source is the Office of Secretary for the Health and Human Services. So this didn't only get to the Office of Research, it also got to the Health and Human Services. So this information, again, is reported here. Getting results and you're not sure if it's the same or not sure what you're reading, this is the time to give us a call and have us help you through it. Reporting information on Healthcare Comply Plus, there may be a lot more information directly at each of these organizations, the Office for Research Integrity and the Health and Human Services. Whether they'll make any more of it public or not is yet to be found until we look further into it, if that's what you wanted. But General Healthcare Compliance gives you a lot of details, so you know a lot about the situation that evolved and led to this particular disciplinary action. Another example for you is here's our source, the California Board of Medicine, for an individual who currently lives in Honolulu. So this is a little interesting. Now, this person's fee and current license is valid. They just he agreed to a stipulation to place his medical license on probation indefinitely. So no matter where they go, their medical license is always going to be on probation. And this is reported by California. You see later on that it's actually referencing a Missouri State Board action. So the California Board picked up on Missouri State Board action and reported it to the sources that Healthcare Compliance Plus uses. So it's, again, the individual has had some disciplinary action, but their license is currently valid. The rest of them go through this particular person had no law enforcement action, and the coverage is again listed there. Some examples to show you the types of information you may have when using Healthcare Compliance Plus. So, use Healthcare Compliance Plus. Well, transactions are trust-based, and to verify, comply, manage risk or reputation could be very costly to your organization. Healthcare Compliance Plus supports a well-deployed compliance program, mitigates the risks of revenue and reputation loss, and to know the employees and vendors you work are not high-risk individuals who have been debarred, sanctioned, or excluded from participation in state or federal healthcare programs. Compliance Plus is based on primary source information from thousands of state and federal sources, as well as international sources as well. Any healthcare transaction is valid by using Healthcare Compliance Plus as part of your background investigation. One of the things that can happen if somebody was excluded or debarred and you want to get reimbursement under some state program or federal program like Medicare or Medicaid, you would reimburse for their treatment that you are submitting for reimbursement, but if it's not being reimbursed, you can also be fined. And when I looked at the fines, it was something like $12,000 per incident of care. So the fine for having an individual provide treatment who is excluded or debarred under programs for which you're going to seek reimbursement for that treatment can really up fast. So that's where Healthcare Compliance Plus is helping you to not bring those people into your organization or to control the types of treatment so they're not going for government reimbursement for treatments that they're providing. So just a bullet point, why Healthcare Compliance Plus is regulatory compliance. It meets legal risk, it advises financial risk, and acts against reputation loss and damage. I'd like to open it up for questions, and I'll unmute everybody.
Hi, this is Gail from Lawrence Hospital Center.
Hi, Gail.
Hi. With respect to, some of what you shared as far as records indicating, I guess it would be a conviction of an ill, clinical action or what have you. How do you find, because my understanding as far as the climate, the legal climate, as far as people who have more of a positive criminal background check, it's not clinically related. People deciding not to hire based more on the criminal background check that you kind of have to be really firm upon why you're making that a part of your decision not to hire. So I understand this is much more incriminating, so to speak, because you have actual records with discipline action, restrictions, what have you, and it's more clinical practice based. But are you finding, like in the legal world, when people go say they didn't hire me because of this, is that been problematic?
As far as the results on Healthcare Comply Plus search, Gail, leaving the criminal, we won't talk about the criminal now, but as far as Healthcare Comply Plus, it's problematic not hiring somebody when you have results for Healthcare Comply Plus, then you have criminal records. Because criminal records, then 23A and everything else comes into play. But Healthcare Comply Plus and disciplinary debarment action, if you're somebody who had such an action, you have to make sure they never provide treatment to an individual for which you're going to seek reimbursement through any state or federal reimbursement program like Medicare or Medicaid. To do that, it's very problematic and not feasible for most organizations to tailor the type of treatment one person does to keep them from falling under reimbursement under those programs, especially if you get in a hospital setting. So there really is little recourse or problems when you do not give somebody an opportunity because they are excluded or debarred under the Healthcare Comply Plus sources.
Okay. And you said fines could be up to $12,000 per provided per practitioner?
Incident of care. So if you consider Medicare or Medicaid reimbursement, those people will be times 12,000 will be $36,000 just for today's treatment.
Wow.
You want to be very careful if you have Healthcare Comply Plus hit. Some of these you saw they still are licensed, but they have adverse action. It's a compliance decision, and we can help you and your compliance department evaluate that, and your legal department might get involved as well. But running Healthcare Comply Plus and getting those 85, 90, 92%, no medical information found, no criminal information found, those are the good, easy ones you just want to keep moving forward with. Get a hit on and slam on the brakes, and we'll just do a little bit more and make sure everybody makes the right decision there.
I believe we're had a hit in the time we've been, that I've been here and that we've been utilizing your services.
The hits we just went over were actually within the last couple of weeks. So we see some interesting hits, but it's a good thing I haven't had to deal with any of that. Anybody else have questions, or Gail, you have further questions?
Would it also show up on the primary source verification or unlikely?
If your search requires us to go to the primary source verification for these certain things, like if your professional license verification is, like, say, Missouri, for the individual who the Missouri State Board had that action, that should come up with a professional license. So when we do professional license verification for clients, we do search disciplinary action. So sometimes, yes, you'll see it on the professional license, and you'll see it again on Healthcare Comply Plus. Okay. Anything else today? Well, thank you for joining us. This PowerPoint will be on SlideShare hopefully later today, and this webinar recording series will be on our website as well. So if you wanted to share this information with your colleagues, it's available from our webpage and from our SlideShare account. If you have any follow-up questions, I welcome you to reach out to Courtney, Lynn, or myself so we can further help you understand more about Healthcare Comply Plus and other services we offer. Have a good day, everybody.